I thank Dr. Swapna for calling me for this wonderful meeting. I think after talking about smile and after talking about these allo slit, and this is just a very cool topic. Just as he said, it's been age old, but now tattooing has become very popular in among youngsters. This is just a basic talk. Even now, I was talking to Dr. Aditya. They are doing a smile, and then the central pupil, they are not doing any cut around the cornea. They are around the cut like a ring. They are using dye, so your cornea can become green. Your appearance. So they are doing a lot of things. But just a basic talk for the post graduation, it will be useful. So it's known as keratopigmentation, also referred as corneal tattooing, and it's a cosmetic procedure designed to enhance the appearance of cornea. And the procedure involves careful insertion of pigment into the stroma and has evolved into an efficient and safe option. Because this is one area, because we see lot of patients coming with one eye uh, leukomatous opacity and nothing is being done. So many people think it's pretty difficult, but it's very simple to color the cornea. So the indications for the postgraduate traditionally in a blind eyes as cosmetic remedy for glaucoma, especially for patients who are having high risk of undergoing any penetrating keratoplasty and they're not able to tolerate contact lenses like colored contact lenses. Sighted eyes for patients who are having vision for suppose glare or photophobia. If it's not in the visual axis, definitely partial tattooing can be done. And recently, for intractable diplopia, people who have a lot of diplopia, it's accepted to do a corneal tattooing rather than wearing a glass and putting a black cover. So this is actually 1869. It was Louis von Wecker who started this, and it was actually in the 19th century itself started. So initially, it's actually a surface method, and it's like anterostromal punctures. We inject the dye or even the suit. Previously, we used to make a suit like from a candle. You make the suit over the a stainless steel metal, and then you insert the suit. That's all we have done like that also. After doing intrastromal pockets, either you can put the suit or you can put the dye in. So dyes for tattoo, again, gold chloride, all these platinum, silver, all these things get reduced in the cornea in situ by the hydrogen hydrate, and you can get a brown or black pigments. But nowadays it's very simple to get organic dyes. So now I get it in just Amazon, 600 700 rupees. You can get a beautiful dye and it works, and you can keep it for 6 months, 1 year refreshed, and you can use it. So the basic contraindications is these cases don't touch these cases for any tattooing, like any active infection, inflammation, or corneal scar with any synechia involved, or any iridocyclitis, history of iridocyclitis, glaucoma, any ocular surface recurrent inflammations, dry eyes, again adherent glaucoma, keratectasia, staphylomas, and neurotrophic keratitis don't touch these cases. So nowadays we have these tattoo guns, which we are very popular, and these guns not only are used for the eye, you can use it for any part. So eye, lips, body tattoo, everything. It's now what we have actually from the Cornea group, even Dr. Muscati, all of us bought in a Chinese product pre-COVID, which is not available now. But now all these things are very available anywhere in the internet, you can get it. So before, what we used to do was we used to create a pocket like this. This was a pretty old video, and we make a pocket like this with a crescent, like how you do a SACS tunnel. Just go maybe mid stroma, you're able to see the crescent, so you're not very deep and you're partially superficial, and make sure that you go 360. And then we used to inject this dye in, but this never used to be very regular, means that you can see it gets stained, but the anterior stroma, if it is very scarred, it's very difficult. So then we used to inject intrastromal injection of dye. But in these cases, it's very difficult to get a uniform coloring, and the patient most of the time says like still little bit of scarring is there. They are not pretty happy about it even if you keep washing. So nowadays what you do, the tattoo gun is very simple. Just use the dye over the cornea, and just this is actually a needle. You can adjust the size of 0.5, 1, or whatever, depends on the you can see how it tattoos, just like how they do a tattooing on the skin. So you keep doing for 2 to 3 minutes or even 5 minutes, and you keep washing, and then after a period of time you can see that it nicely gets stained, and it's mostly permanent. It never it never goes off. You can see how I wash it off. Even after washing, it doesn't go. So this is a very simple one. Even a local like scars like this, remove the epithelium first. That's very very important. Remove the epithelium, and make sure the epithelium is off, and do it on the stroma, same a drop, and then do it. And depends these patients, if you have a shallow anterior chamber, you can use a 0.5, 0.7. There is a marking in the in the machine itself, so you can actually adjust the needle depth. And many types of needles are available. We can use it, and it actually gives very good results. Actually, I had 4 years, 5 years of patients who have followed up, and this dye which is from US, it's very cheap also, and it stays. And I usually use the contact lenses, a bandage contact lens, at least for a month, because epithelium takes, because it's a little bit irregular, the epithelium takes some time. So you use it for at least for a month or two. You keep the contact lenses in. So after this tattoo, you can see it like this, and in patients you can actually see the first day post-op so well. The patients are really very happy, and they've seen these patients. You can see this is almost a 1 week post of another patient, and this is almost 2 years. This girl actually did 2 years back. She came about 10-15 days back, and I could see, you can actually cannot make out which eye it has been done. And these are patients we've been doing quite a number of patients. So for 10 commandments is explained, it is only for cosmetic purpose. Don't push the patient. The patient should push you. You don't push the patient. The patient says, I'm finding it difficult, then you do it. You don't counsel, and don't need to push the patient. Clearly rule out all the contraindications. Use a tattooed gun. It's very readily be available. It's a very simple procedure, mostly permanent. Post-operatively, avoid infections because they are very compromised eyes, and rule out any history of viral keratitis is very important. Avoid cases with iris incarcerations, and no water sports for 6 months, and do only if indicated. Because what I feel is, most of the patients whom they come with their own interest, they are very very happy, very very happy. And this is not performed in many places. I don't know how many people are doing, even big institutions. I do not know where they are performing or not, but I regularly keep performing this at least 1 or 2 per month. And we don't really like popularize or do something, because anytime these patients can get infected, can get into problems. So unless they are motivated, you don't push the patient. Thank you.
Dr. Sidharthan,
Yes,
what is this dye actually? This is a carbon-based dye.
yes, it's a regular carbon-based dye, and it is a permanent ink. It's an ink marker, sir.
Okay.
It doesn't have any. It is from a medical. It's from the vegetative matter. It's not from any chemicals or anything like that. So it stays quite some time.
But you also showed some other dye, gold or platinum.
That
dye.
we don't use, sir. Just for this thing I showed. But nowadays these dyes are readily available, and
But-
it's very compatible.
But we don't use this gold and
That and
platinum.
all we do not use, sir, because that
Better.
goes and changes the color and all.
But better.
This
better, I
dye,
think.
and these dyes are in different colors also, sir. You can get brown, whatever you want. You can get the color dye. It's not because our irises are very dark. We use black. Otherwise, you have light blue. You have brown, light black color. All these are available ready-made. So before we used to use suit and all, but now this is very very readily available.
Otherwise, if you start using gold and platinum dye, I don't know whether the dye will
They
persist
will
in
be
the
available.
cornea. It will become okay. And I don't know whether these metallic dyes, whether compatible with MRI, the imaging, all this may be.
This is nothing, sir. This is just a vegetative this thing, and usually doesn't cause any problem. Even if there is any chemicals involved, I don't think it is going to create any problem.
It doesn't elicit any inflammatory.
Nothing, sir. Nothing. Whatever I have seen, only thing is there's no. Make sure that no iris is involved, because if iris is involved, it can always get absorbed into the iris, and you can get reactions. So make sure it's like there is no adherence of any irises there. That's very important. And viral keratitis, because epithelium starts breaking down. Those two are very important, sir, to rule out.
Yeah, since you are showing gold, I was thinking gold can still elicit inflammation, even though it is non-magnetic. MRIs can still elicit inflammation in gold.
Just one comment on this, that if you're doing tattooing and the patient has a very vascularized scar, you need to tell him that the dye may not remain permanently, because the more the vascularization, slowly the dye gets eaten away by the blood vessels. Maybe after 3-4 years you might have to repeat, but again repeating is not a problem.
Yes.
So there is a risk of infection. How often you encounter?
Very rare, sir. Because we keep the bandage contact lenses for 2 months, at least 2 months. So usually the epithelium heals well. If you just leave it and remove the BCL after 15 days or something, sometimes it can be irregular. But most of the times I keep it for at least 45 days. We keep it. So the epithelium heals. Very rare, sir. Very rare to get any infection. But still, you with the BCL on, antibiotic once a day, we have to use it till the BCL is there.